Viviana Avila is a mom of two, with number 3 on the way. So though she's still a young mom, she has a bit of experience when it comes to having babies.
During pregnancy, you hear all the things to expect and how things could go and are gonna go.
You get a lot of advice and insight on what to expect from all kinds of places, from the internet and books, other people in your life who've had babies, or even some who haven't. Viviana's mom works in community health and was an excellent resource. So Viviana thought she was ready for most things, even a little bit of sadness that a lot of moms get, known as baby blues.
But I think, especially with my first daughter, I was not expecting postpartum depression to hit like a brick wall.
She had no reason to expect it, really. She'd never experienced depression, and since she had prepared herself for baby blues, it took a minute or two for her to realize that these scary thoughts she was having were more than that.
These thoughts are not normal. Like, they're not okay. And you know that, and you know you would never act on them because you look at that baby and that's your world. You love that baby. And looking for somewhere safe to express those feelings and find help is so scary.
Who is safe to reach out to? What do you say, especially when even you are horrified by your thoughts?
These are thoughts you would never act on, and you don't even know why you're having them.
But many new moms in America have them. 19% to be specific, so 1 in 5 new moms. And for Latina and Hispanic moms, like Viviana, that percentage doubles to 40%. Black moms face the same staggering risk as Latinas. But while this devastating, joy-stealing condition is treatable, like Viviana, many moms just don't know where to turn for help. Latina and Hispanic moms are 57% less likely to start treatment for maternal depression than their white counterparts. Black moms are 41% less likely. And this is a big deal because maternal mental health conditions are the leading cause of pregnancy-related death. Now, there are a number of reasons for this stark and persistent disparity, both systemic and cultural. But recently, an idea has started to gain traction across the country, an ancient intervention that might make a difference. They're called doulas, and they can provide the kind of culturally connected care that may save lives. From Texas Public Radio, this is Petri Dish. I'm Bonnie Petrie.
Support for TPR comes from the University of Texas at San Antonio's Brain Health Consortium, a pioneering research hub advancing neuroscience, neuroengineering, precision medicine, and more. Learn more at utsa.edu/BHC.
The postpartum depression part, it was just a ride, and you don't know how to get off, and you don't even almost know that you're on it. So yeah, it's a doozy.
Viviana Avila had slipped into this chasm of sadness. She felt disconnected from her brand new baby girl, which made her feel like she was maybe broken as a mother. She didn't make the connection between these feelings and what is commonly known as PPD.
I didn't know that I was in it, because what looks like postpartum for me or what looks like baby blues for me could look like nesting to somebody else. Like, there's just no one, like, this is the stuff to look out for, because it could be, but then again, like, it also could not be.
Right. What is a normal rearranging of a home to more comfortably accommodate a growing family? And what is a kind of compulsive drive to achieve some standard of perfection fueled by unwelcome, intrusive thoughts that you cannot make stop. It's difficult, if you love someone going through this, to know from the outside, and it's difficult to know from the inside.
I'd gone to the doctor and you do all the tests and have you cried in the last week? Like, you don't want to be honest in those tests because it is so scary and you don't know what they're going to think about you. I'm an unfit mom. What if they try to take my baby?
That is a common concern among minority moms who experience symptoms of a mental health condition, and it's one of the many barriers to treatment for them. They can also grapple with cultural stigma. In some Latino and Hispanic families, there is this idea that women must put the needs of the rest of the family above and before their own needs, so these moms might feel distress and guilt if they need to ask for help for themselves. There can also be this idea that if you need mental health care, you're weak and must be truly crazy. And if you admit to that, will you do harm to how your family is perceived? Will it make you all look bad and weak? It's a lot for a mom to deal with on top of depression and anxiety and being a new mom. And if she does decide, I'm going to do it, I'm going to reach out for help, and she seeks out a mental health care provider.
We know there's bias in care, and specifically the lack of culturally responsive services.
Dr. Kelly McLaughlin-Bell researches ethics and equity at UT Health San Antonio with an eye toward reducing health disparities in communities of color.
We know that maternal mental health conditions, including depression and anxiety, are among the most common complications of pregnancy in the postpartum period. And unfortunately, we see that Black and Latina mothers experience higher rates for maternal mental health conditions, nearly double the rate of that of white women. And that really highlights some of these deep racial disparities that we see.
She mentioned bias there. We hear a lot about bias when we're talking about issues of race and racism in America. Bias is prejudice, right? And whether we're aware of it or not, it's common.
So I think as humans, we all have a certain level of bias. We have bias to help keep us safe from things that are associated with danger, like bears. If we see a bear running at us, that's going to help to keep us safe if we move away from it. But media can also play into determining bias or creating bias. And so things like the way that we stereotype certain identities can make us form bias in our own selves. And so that bias that is underlying within everyone can oftentimes seep out into the way that we offer care to patients and help patients make decisions.
Good and caring healthcare practitioners can be affected by personal biases they're not even aware of, right? They're called implicit biases. And these implicit biases can inform, in small and subtle ways, the way they interact with patients. For example, they might have an unconscious idea that women of color don't suffer from mental health issues.
Oftentimes we see historically that providers may feel that specifically Black and brown women don't need or don't have as many mental health conditions. And we have this kind of strong woman syndrome where they think that we can just move on throughout the day and that there aren't issues that we're facing. And that can lead to lack of awareness and lack of resources being made available to families.
This concept that Black women are the epitome of strength and stoicism and independence and caretaking is so prevalent, it's got a name. It's called the strong woman schema, and it can be a powerful barrier to Black women accessing the care and support and help that they need. Add to that, often healthcare providers are from different cultures than their patients.
So there's disproportionality in terms of culturally congruency amongst providers and patients, where we know that where there is congruence, we tend to see lower rates of disparities.
Cultural congruence occurs when a patient's care incorporates their cultural values, beliefs, and practices to improve outcomes. And, maybe unsurprisingly, it does lead to better healthcare outcomes. That makes sense, right? And sometimes it happens. Healthcare providers may come from the same culture as their patient, or a provider may have learned enough about the cultures of their patients to be able to sort of connect in that way. But often it doesn't happen. There is a disconnect that can leave patients and their babies vulnerable to worse outcomes. Then what do? Well, maybe you call a doula.
They can speak the same language they can, especially if language is a barrier, knowing the cultural traditions, knowing the practices, knowing the foods.
More on that when Petri Dish continues.
Support for Petri Dish is made possible by UT Health San Antonio's Mays Cancer Center, South Texas NCI-designated cancer center, providing cancer care for patients, advancing research, and educating the next generation of leaders. Mays Cancer Center is working to end cancer in South Texas and beyond. Learn more at mayscancercenter.org.
Welcome back to Petri Dish. I'm Bonnie Petrie. So, what is a doula?
Yeah, a doula is someone who helps families or couples with transitions.
The word is ancient Greek. It's one who serves. And in modern times, doulas serve in a variety of situations.
Be it childbirth, be it trying to conceive, be it end of life sometimes. So we kind of focus on like 4 different pillars, like advocacy, informational support, physical support, and emotional support. So those are the ones we try to hit to make sure that our client is fully supported.
That's Quanisha Magruder, and she founded the San Antonio Black Doula Collective and is on the board of the Texas Doula Association. When we spoke, she was accompanied by her spectacular infant son. So when you hear a baby here, that's him. All right, so what role might a doula play in preserving the mental health of someone who's about to give birth?
It's the prep work beforehand and the trust you build as a relationship as a doula with each family and each person, because you're the one stopping to say, like she said, her vision of what birth can look like, but then expanding that. So we are even talking about like what happens if the baby has to go to the NICU and you know, do your husband stay with you, your partner stays with you, or do they go with the baby?
And when the tsunami of labor and delivery begins, doulas become an educated and trusted ally and advocate.
We're setting that environment up for success as much as we can. And we're making sure that anything that is trying to inhibit the safe space is either, you know, can we fix it? Can we move it along? Or can we get them to focus on something else if we can't move it out of the way?
When mom's focus has turned inward, as it does during labor, their doula becomes a sentinel.
That's kind of why it's so exhausting, because you're constantly scanning the room, you're scanning your client, you're scanning like things. So you're making sure that you're safe, they're safe, and that the baby's okay too.
All of that eases a mom's mental load, but it also manages expectations. So if your labor and delivery takes an unexpected turn and you have to toss your birth plan out the window, you're less likely to feel like a failure if your doula has already walked you through that possibility. Now, this is important because research has found that negative childbirth experiences are predictive of postpartum depression, and one study found that women who received doula care were nearly 60% less likely to be diagnosed with postpartum anxiety or depression. That is a compelling number. And for women of color, doulas can bridge language and cultural gaps and reduce health disparities by facilitating communication and serving as intermediaries between clients and healthcare providers. Bridging these cultural gaps can be as simple as translating a doctor's recommendation, maybe into their native language or maybe into their cultural language.
Culturally, linguistically, and ethnically appropriate.
That's Angela Warren with the San Antonio Metropolitan Health District.
Just because you told me I have high blood pressure, I don't know what it means to identify the high sugars, a high fruit, corn syrup, whatever it is that's in the food that I'm used to eating. how do I make that adjustment? So it's not just the nutritionist part. It's like, send me to somebody that cooks like I cook and show me how to reduce the sodium.
These small things that are really big things can make a tremendous difference in both medical and mental health outcomes for Latina, Hispanic, and Black moms. So, how do we increase access to doulas for all moms, but especially Latina and Black moms? Well, one way is for Medicaid to reimburse states for the service. Right now, almost half of U.S. states and D.C. do just that. Texas is not one of them, though there is a proposal on the table, and doulas, like Quenisha, will keep pushing for change.
With Texas Doula Association, that's kind of one of our goals that have been is to make sure legislation is pushed for doulas to be covered. And we've kind of gotten some baby steps into that. And I think it's been good to collaborate with policymakers to kind of give the voice for doulas to say, like, here's what we actually need. I know you're trying to figure out stuff. So let me tell you what we kind of need from the voices of all the Texas doulas that we have in community.
UT Health San Antonio's Kelly McLaughlin-Bell agrees.
Doula support should be covered by healthcare insurances. And obviously, it's a very contentious topic right now. But in the meantime, while we're looking for funding, while we're trying to advocate for having that coverage for all families, the community's been doing this work, as Quenisha mentioned. And so how can we work to ensure that doulas are available for all families in a sustainable manner?
Local communities are filling in the gaps where they can. In San Antonio, there is a program called Healthy Start. It provides a variety of services throughout pregnancy and up to 18 months after birth. And one of those services is doulas for high-risk moms. And last year, the Texas Maternal Mortality and Morbidity Review from the Texas Department of Health and Human Services recommended that the legislature enhance coverage for birth doulas and postpartum doulas to improve maternal, medical, and mental health outcomes. Oh, and by the way, while I was writing this show, Viviana Avila gave birth to her baby number 3, and she, the baby, and her whole family are doing very well. Viviana says she's leaning on her family. Both her mom and her sister have training as doulas, and she feels like she's in a good place. And she has advice for other parents who find themselves where she was. She says, reach out. Why don't I just read you what she wrote to me? Viviana said a lot of women go through postpartum depression, and because it's something that is scary to talk about, women keep it to themselves. But she says, once I brought it up and was open about my experiences, I realized how many women around me experienced similar thoughts and feelings. She says, I just felt heard and validated, and it made it seem less scary. And then I was able to start working toward healing. Thank you, Viviana, and congratulations. And before we go, I just want to thank everybody who participated in this conversation. Quenisha Magruder, Dr. Kelly McLaughlin-Bell, and from Metro Health San Antonio, Angela Warren, and Zita Powell, and Joseph Garcia for getting us all together. Thank you so much. This episode of Petri Dish was produced by Jacob Rosati, TPR Vice President of News Dan Katz, and me. I wrote the show. Jacob composed all the music and created the sound design and edited the script. Petri Dish is a production of Texas Public Radio. I'm Bonnie Petrie. Talk to you soon.